Ladies and gentlemen, dear colleagues, it gives me great pleasure as the President of the World Organization of Family Doctors, Wonca, to contribute to your action to strengthen general practice in Austria. It is of the utmost importance for the population's health that primary care in the community, is as strong and as good as it can be. And one of the factors that influences that quality is the teaching and training of future general practitioners, nurses, midwives, physiotherapists and others who work in the community, to teach and train them in that community. Special training, specialization training in the community, in the practice where they are going to work. Specialty training is one of the core components to strengthen primary care. And your action to achieve this in Austria and to foster this training in Austria is of the utmost importance. It should be seen in the context of what the WHO has called primary care now more than ever. Strengthening primary care now that the changes of health in the community ask for a strong response in that community. A response to chronic diseases, to comorbidity and multimorbidity, care for frail elderly people, care for people in socially disadvantaged circumstances. This all asks for the best care in the community. For policymakers, I think it is very important to realize that primary care in the community is where most of the health problems, most of the people are seen most of the time. That is where the best first response can be made. Only a small proportion of health problems in the end will end up in the hospital. To make sure that we use the scarce resources to its very best, it is important that what is sent to the hospital is what is the best to be done in the hospital. And that, again, asks for strong general practice. Your action should be seen in a context in which also research in primary care, research in the general practice environment is fostered, and where also the teaching of medical students during their undergraduate training is done in the community. Specialization, undergraduate teaching and training, research, the three components to strengthen primary care. Your action for Austria is very, very important and needs the full support of policymakers, medical schools, the medical profession and the allied health professions together. I wish you all the success with it, and I look forward to see the results coming soon. Thank you very much.